This is not getting much play on the national news, so I'm just going to report from here in Washington, D.C. on what's happening at the National Institutes of Health. This is Dr. Shiv Prasad. He oversees grants there as a scientific review officer and who is speaking here as a private citizen and not in his official capacity at the NIH.
What we're seeing is massive indiscriminate cuts to grants and to contracts and to staff. And there doesn't appear to be any thought put into this because some of the staff who have been let go, for example, contracting officers, they've had to be recalled to deal with contracts that we fund. So there wasn't a whole lot of thought put into this. Human resources staff were also let go, and some had to be brought back to deal with basically the firings of other people. So it's been a difficult time, and it's been tumultuous, really.
Prasad has a special interest in NIH research as one of the millions of Americans who's personally benefited from it.
I was diagnosed with colorectal cancer in 2009, and I am here because patients before me volunteered for clinical trials to advance the development of new drugs. And I am concerned that future cancer patients won't get those opportunities because of the cuts. Already we know that clinical trials have been stalled, which means no new patients can be enrolled, which means the patients undergoing treatment, they're on sort of a hold. And that could have a devastating effect for people who look to the NIH for hope.
And with studies either killed or placed on hold, the people who volunteered for them are betrayed.
When people enter clinical trials, they have an expectation that they will be taken care of and they will get the benefit of research. The therapies might not benefit them because they're experimental, but they expect that they will get the benefit of attention of clinical staff, which they're not getting.
And maybe if these cuts were done strategically to make NIH more efficient and streamlined, a little pain might be justified. But these cuts often cost more than they save. Staff are fired and then must be hired back or replaced at great cost because they're critical to NIH operations. Or studies are killed after the work's been completed but not yet written up, essentially wasting millions of dollars.
If there's a $5 million grant for 5 years, $1 million each year, if that grant is ended in the fourth year, the taxpayers don't save $1 million. Taxpayers have wasted $4 million because that research cannot be completed.
And finally, when the NIH cuts are combined with cuts to universities, we lose the fellowship and mentorship programs that attract and train new scientists and doctors.
We are losing the next generation of scientists, the people who will find the discoveries in medical research, who will work towards cures for diseases. We're losing them. And many people are considering going abroad. So we're also losing America's leadership in biomedical research.
It's only been 9 months, and already the best and brightest young minds are pivoting to programs in Canada, England, France, and especially China, all countries that are taking advantage of the decline in U.S. research leadership. For Science Update, I'm Bob Hirschon, reporting from Washington, D.C.